So welcome to the Atlanta Women's Foundation's final Choose to Challenge webinar in celebration of Women's History Month. I'm Kari Love, the CEO of the Atlanta Women's Foundation, and we're so glad you've joined us. I hope you'll be inspired and motivated by our event today, featuring a few of our grantee partners who will share about their work with women and girls during the pandemic and how we are working together to help women rebuild their lives after COVID-19 through AWF's new Rebuilding Women's Initiative. I hope you'll consider giving to AWF in honor of the culmination of Women's History Month. It'll take all of us to help rebuild the lives of women and girls in Atlanta. Your gifts will ensure that more women have access to health care, childcare, and shelter, and will continue to receive much needed financial assistance. To learn more and support the Rebuilding Women's Initiative, visit our website, atlantawomen.org. Now it's my pleasure to introduce DeShonda Hughes, AWF's Executive Vice President of Mission, who will be celebrating her 21st anniversary with us in just a few days. She will share a little more about our strategic grant making and will introduce our moderator for our program. DeShonda?
Thank you, Kari, and welcome everyone. We know you've heard how the pandemic has affected women in our community, women served by our grantee partners. That is why we are excited that you have joined us here today to hear about successful programs and initiatives we have funded and continue to fund. While there is much work to be done, our help is needed. These organizations, all those we support, make a difference for women and girls here locally. They are doing the work to help rebuild women and girls. Each of our speakers with us today represent an organization with one of our grantee cohorts, which includes the Women's Pathway to Success program that addresses barriers to workforce development, the Breaking Barriers Building Women's Economic Empowerment program that breaks barriers to higher education and asset building, the Promoting Women and Girls Mental Health and Wellbeing cohort, which addresses barriers to mental and behavioral health access, and finally, our COVID-19 Grantee Emergency Relief cohort, which address the immediate needs of women and girls in the wake of COVID-19. Our Rebuilding Women's Initiative aims to continue on the progress and success of COVID-19 relief for women and girls in our community. So without further ado, it is my pleasure to introduce our moderator for today's conversation, Julie Finn. Julie is a sought-after speaker, executive coach, women's leadership expert, and podcaster. Julie is on a mission to inspire, engage, and encourage professional women to excel as leaders and entrepreneurs without burning out. She is a chief mentor at Working Mothers Mentor, where she supports high-achieving women as they learn to play big and make bold moves while thriving in their full balanced lives. She's also a graduate of our inaugural Inspire Atlanta class of 2018. Thank you, Julie, so much for joining us today. Take it away.
Thank you, DeShonda and Kari, and I'm so excited to be here. So good morning to everyone, and thank you for joining us for today's discussion, Choose to Challenge Rebuilding Women After COVID. We really appreciate you taking your time, maybe your lunch break, to be with us today. Our hope is that you will leave informed and inspired to be involved as we help women and girls recover from the impacts of the pandemic. We will begin by having each of our esteemed panelists introduce herself. We will then explore the myriad impacts of the pandemic on the lives of women and girls in Georgia and the ways in which these organizations have responded. We'll then discuss the current state of women and girls and what's being done to support their recovery. And lastly, we'll talk about how you can be involved. Does that sound good? Great, let's dive in. So first, introductions. I'm going to ask Tiffany to get us started.
Absolutely. Good morning, everyone. I am Tiffany Colley-Bailey, the CEO of Girls, Inc. of Greater Atlanta, a youth development organization that focuses on inspiring all girls to be strong, smart, and bold.
Thank you, Tiffany. And now, Jamia.
Yes, good morning, everyone. I'm Jamia Dorsey. I'm the CEO of the Center for Black Women's Wellness. We're a community-based nonprofit located in Atlanta, and our mission is to improve the health and well-being of underserved Black women and their families.
Thank you. And Lindsay.
Good morning, everybody. My name is Lindsay Garland, and I serve as the Development Director at the Georgia Budget and Policy Institute. GBPI strives to be an anti-racist research and advocacy organization that advances lasting solutions to expand economic opportunity and well-being for all Georgians.
Thank you, Lindsay. And Sandeep?
Good morning, everyone. Thank you for having me here. I am Sandeep Gale, like Julie said, Executive Director of Literacy Action. Definitely thank you for having me here today. For those that don't know Literacy Action, our mission is to build better futures by empowering adults with literacy life and work skills.
Thank you, Sandeep. And last and certainly not least, Alnori.
Hi, everyone. Alnori Gutlai. Health and Prevention Vice President at the Center for Pan-Asian Community Services, also better known as CPACS, which is a nonprofit organization located in Atlanta, Georgia. Our mission is to promote equity for immigrants, refugees, and the underprivileged through comprehensive health and social services, capacity building, and advocacy.
Thank you. Well, thank you, ladies. We're so excited to have such wonderful people here to share their experiences of serving women and girls during the pandemic. So let's start by going back to last year and talking about the early days of the pandemic. I would love to start this discussion by understanding what specific types of challenges and barriers women and girls have faced because of the pandemic. Lindsay, I'm going to ask you to get us started.
Well, I'm going to start by stating something that's probably obvious to all of us on this call today, and that is the reality that women and girls experienced disproportionate obstacles to thriving before the pandemic. Women in Georgia have been more likely to live in poverty long before COVID-19 reached our borders. But when Georgians in general entered this pandemic, only about 40% had enough assets and savings to help them subsist in the event of an emergency or income loss. Only 40% of our neighbors had that savings. As we have all experienced over the past year, COVID-19 has been a year-long emergency. The lack of savings was compounded by low wages and poverty wages, if we're going to be frank. Among workers who have been paid poverty wages, women are the overwhelming majority, 79% of those earners. These poverty wage occupations ultimately are those that suffered the toughest job losses because of COVID, and they have been the last and will be the last to recover. This is made evident by the fact that the majority of unemployment insurance claimants in Georgia have been women. I want to underscore that women losing their incomes has extraordinarily detrimental effects on the well-being of their families, because mothers are the primary breadwinners or co-breadwinners in 2/3 of Georgia families. From GBPI's perspective, for Metro Atlanta and Georgia to really recover from the pandemic and the pandemic recession in particular, we have to give very careful attention to the systemic barriers that hindered women from having economic opportunity and prosperity before the pandemic, and that have been worsened because of the pandemic. For GBPI, and I hope for everybody on this call, we take a firm position that there can be no going back to normal. And from our perspective, this requires a partnership between public, private, and philanthropic sectors that will work to address the current needs of women, women of color in particular, and ultimately implement policies that will help women, people of color, and those workers earning low wages recover quickly and ultimately recover together.
Thank you, Lindsay. That was really interesting. And I really appreciate the way that you laid the groundwork and help us to understand from an economic perspective the impact. I'd love to look through another lens, Jamia, and understand from your organization's perspective, what have been some of the challenges and barriers that women and girls face during the pandemic?
Yes, thank you, Julie. And I absolutely echo what Lindsay just said, because, you know, we found, like so many here already in this room, in this virtual room, that the women that we were serving were already very vulnerable. As an organization that provides healthcare specifically to uninsured women, and Black women are disproportionately impacted in terms of lack of income, lack of insurance, but then segue to they're disproportionately impacted by so many health disparities and health inequities. And so what we were finding were two things. One is that women, again, who were already teetering over the edge, were more vulnerable. Women who were doing gig work, who were already working part-time jobs in certain industries in which the hours just totally got cut, or they lost their jobs, or women who are deemed essential workers who are put in positions in which they literally were really terrified about, okay, well, what does this mean? What is the impact of this? Am I bringing something to my family, to my children? Of course, many women living in multi-generational households. So I think there were a lot of concerns related to their own health, certainly mental health, escalating mental health needs related to, the trauma that we all experienced, and then layering that with the economic and the financial hardships that were placed on women. So what we were really finding were, women who were totally and completely distraught. We really began to do two things. I mean, one was to make sure that women continue to have access to healthcare. So we accelerated our plans in terms of making sure that we implemented telehealth. We were providing home monitoring supplies to women so that they can continue to make sure that their pre-existing conditions were addressed. But then we also were trying to figure out, how do we make sure that we can stabilize households through meeting essential needs? And so we really dove right into COVID relief efforts, making sure that women were able to be supported through rent and mortgage assistance and utility assistance, grocery support. And it really mattered. It made such a difference. But the effects are long term. And I think that we're going to really have to come up with some solutions from, certainly working collectively, but from a policy standpoint, to figure out, how do we truly rebuild women and girls?
Thank you, Jamie. That's really helpful to understand what work you guys have been doing on the front lines. I'd like to drill down now and talk about the social and economic needs of girls and how they were affected by this. And Tiffany, I'd love for you to jump in on this one.
Absolutely, Julie. So when we saw our girls went through multiple impacts when it comes to it. So when you start to look at it, you first talk about the academic piece. I would tell you that 85% of our girls that we serve at Girls in Greater Atlanta are coming from families that are from under-resourced communities. And within that, 71% of our girls were already reading below grade level. And so there was already an academic gap for them. And then we sent them into this virtual academic world where they were lost. And then at many times the technology wasn't there for them. They didn't have the opportunities that some of their other students that were coming from other communities had. We also experienced it from a social emotional learning place. So we had 8 and 9-year-olds that were used to being little girls playing that now became teacher. They became babysitter. They grew up a lot faster than what we would have wanted them to, because mom and dad had to go to work. Mom was an essential worker, and so she was working more, or mom lost her job. And so they felt the impact of what it was to be in this up and down cycle of, I'm in school, I'm out of school. Mom was always worried about, can I pay my bills? Is the stimulus coming in? How does this impact the family? So we saw our girls go on an emotional roller coaster. And what we see even right now is that we talk about the long hauler impacts of COVID for those who have had it. We see it in our girls emotionally. We see the long-term impacts that it's having right now, that they don't feel secure. We're used to creating a safety zone for them, a safety net, but really the pandemic took away that safe place for them, that safe place where they could be a child, a safe place where they could learn and interact and begin to continue to develop as a young lady. And a lot of them had to develop a lot faster and had to go through a lot of the emotional pieces, as well as being now, from research, what we hear, especially for our girls that are coming from under-resourced communities and our girls of color, many times that they're going to find themselves to be 3 to 5 months behind academically. And it may take them at least another 2 to 3 years before they fully catch up from what has been from this pandemic.
Thank you, Tiffany. That was really helpful to understand the specific needs of girls. And I think a lot of us understand how distance learning has had impacts on them, but I think a lot of people haven't thought about sort of the long-term implications and how long it will take for them to truly recover. So thank you for that. I'd love to talk about sort of from an economic perspective and the economic well-being of women. So Sandeep, I know this is a passion of yours. So can you talk to us a little bit more about how COVID has affected the economic well-being of Georgia women?
Absolutely, yes. And thank you, Julie, for that. And Tiffany, I echo, and so glad that this is a perfect segue into when we talk about education. We have firsthand seen the impact of COVID has been intensified when you look at gender equality, when you look at issues of digital divide. And again, one thing that I do want to bring to everybody's attention, and these are conversations we're having all around the state and region, these are not new issues, and by no means be fooled that these are issues that are just now coming to surface. They're just being intensified because of COVID. Clearly, we have seen disparity when it comes to access to resources for communities of color. We have seen those challenges before. We have seen gender equality. And I'll tell you this, like many other aspirational women, I'll say, I tell myself and anyone who would listen to me that 2020 was going to be a landmark year for gender equality. But my outlook completely shifted, like many others, when we saw this, COVID come our way. And again, I tell this to everybody, this is not like a project that had a start and an end date. It came up upon us and it's going to eventually go away, but we are in a better year to plan. Many folks are getting vaccinated, but clearly coming back to the challenge, what we have seen firsthand, our biggest challenge was, and again, giving you a bit of a background of Literacy Action student body, 95% of students that we served are people of color. 68% are women and girl, anywhere from age group 16 and over. So it became immediately very critical for us last year when things shifted. Our entire service delivery model shifted from on-site learning to virtual learning. And we lost a lot of our student body, and predominantly who we lost was the women. Because clearly, I know Tiffany, you had touched on that, and Jamea, you had touched on that. Women's role shifted all around the world, not just here in Georgia, because now their priority is more focused on being a caregiver, whether it's for their parents, whether it's for their children. I think many of us have witnessed that in our own circles as well. But for us, the challenge was, how do we retain the student body that we already have on hand? And many of our students had the challenge of what I just talked about, of digital divide. First challenge was not having access to resources, that means technology. Second is, if they have access to technology, the challenge was the decision has to be made whether that technology is to be used by their children that are doing homeschooling, or will the parents have to use it for their education purposes. And last challenge was not knowing how to use technology. So again, the issues were all around. So our goal was, along with the help of many other, I have to say, passionate donors like Atlanta Women Foundation, Blank Foundations, and others, we were able to provide tablets and technology to our students. And we're able to collaborate with some of the internet providers where we were able to provide hotspots and technology to our students, specifically, like I said, women and young girls, because I think many of us have heard the statistics that have come down, I think from Melinda Gates Foundation, around 20 million girls of the secondary school age will never return to classroom. That is a huge issue here. I'll stop right there, Julie.
Thank you, Sandeep. And thank you all, because I think we've done a great job of laying the groundwork for this discussion, that we have a sense of how pervasive and how comprehensive, meaning at how many levels the impacts are for women and girls. What I'd love to do now, and Sandeep, you started to talk about this, is talk about how your organizations have had to pivot in order to respond. And I know, Sandeep, you said that your delivery model had to change pretty much immediately. So I'd love to understand perhaps some of the innovations that you've tried and what successes that you're seeing. And Alnori, I'll let you jump in first on this one, please.
So as a domestic violence shelter in Atlanta, we had no choice but to continue to provide services. So of course, with the pandemic, safety became a larger issue in terms of, who needs to get quarantined, who can get exposed to COVID. So we had to put extra measures. So we had to increase our need for financial support, because before we tried to provide hotel stays for women and girls before they can come into the shelter, so that we can ensure that we provide enough time for them to get quarantined. And then also we had to, as an organization, respond to the need in food scarcity. So food distribution, we started food distribution weekly. So we would have people from the community line up trying to get food, because loss of income, that affected people's ability to buy food. Basic needs for the agency, masks were very scarce, hand sanitizers were very scarce. For the first couple of months, we had to look at resources where we could purchase those. We've been fortunate that we are also a federally qualified health center, so we had some connection. But again, in the first couple of months of the pandemic, everything was scarce. We had to support, search for additional funding for rental assistance. And definitely AWF has been very instrumental in that, because when women-led households, when they've lost access to income, how would they pay for their next month rent? How would they pay for food? We also put additional emphasis on increasing access to COVID testing, because for the immigrant community, that was very hard. Information was not easily accessible. Information was not translated. So there were misconceptions about COVID-19 and also who should have access to it. So those were a lot of things that we had to address. We're still continuing to address it, even with vaccine rollout. So those are just a few of our ways that we've had to address issues, and more issues are coming up that we, again, because of job loss, people are still not going back to their work. Places are still not opening, and some businesses in the area have closed. So women who are limited English are now looking for other ways to find income. Immigration status was also an issue. It's still an issue. So how do these women who have lack of access to immigration help? How could they continue to do that?
That's great, Alnori. Thank you. And I just want to highlight the fact that both Alnori and Sandeep have done a great job of helping us understand how they've had to change the way that they deliver services and how AWF's funding has been such an integral part of that. I would love to hear from our remaining panelists about how you've had to pivot, what innovations you've had, and also specifically drawing in how AWF support has been integral to your ability to do so. So I don't know who wants to jump in first. Maybe Tiffany, since you're already unmuted, would you like to take that? And then I'll ask Lindsay and Jamie to also weigh in on this question.
Absolutely. So I'll tell you that we had to quickly make the pivot because to provide that social interaction with our girls again, so that they could see each other. And so we moved into virtual programming pretty quickly. And then once it was safe to reopen our doors somewhat, we did in the summer to provide some limited in-person programming in the summer. But really what our major initiative was, two things. We recognized that as we were having that virtual interaction with our girls, we saw the social emotional need, right? We saw the gap. And so we worked with a licensed therapist to create a wellness program for the girls to help the girls really be able to express themselves and understand what they were feeling. This is anxiety. And when I feel this way, here's what it's called, but here are some coping skills and here's how we can support you. As the girls moved back into school, we created a full day in-person virtual academic program so the girls could come in our center. Moms had to go to work. They still had to provide. And so, for our parents, they didn't have the choice about being able to keep their girls at home. Some of them had to make choices to send them to grandmother or send them to auntie who's out of town, but who really is not technology, inclined. And so bringing them into a safe space where we brought in teachers to help support them to be able to continue to successfully navigate their academic day was really important. And I'll tell you that we absolutely could not have done it without the support of AWF. They allowed us through their funding to really expand our program and make it affordable, make it free to working mothers who needed us, who wouldn't know what to do without us, right? For our working mothers, they care about the safety of their kids just like everyone else. And they want to make sure that their babies have an opportunity to receive, the greatest support. And AWF did that. They made this program available, even for us being able to, we've got a spring break camp coming up next week. And so all the girls who are coming to that spring break camp, they're coming in because of AWF, and their parents are able to be supported through those programs. It is organizations like AWF who have really stepped up during this pandemic to make sure that girls and their mothers and parents have the resources to care for them and for organizations like us to be able to support them.
That's great, Tiffany. Thank you very much. And Lindsay, can you tell me a little bit more about how I know your organization is a little bit different from the others in terms of what you do, but any ways that you've had to pivot or how you've had to innovate and how AWF's funding and support have been integral to that?
Yeah, Julie, you've hit the nail on the head there. For anybody that's not familiar with GBPI, is a research and advocacy organization, or think tank, if you will. We're big fans of plans. We have lots of plans, work plan for everything, a research plan, an outreach plan, a communications plan, plans across the board. And when the pandemic reached Georgia on crossover day of last legislative session, GBPI had to do something very uncomfortable and throw out our plans. And that required us to really lean into research, outreach, and communication efforts that put people first and what they needed during the pandemic. I'm really proud to say that our research team in response to the pandemic produced 27 COVID-specific research products that ranged the full gamut from deep dive research on recovery packages to how Georgians could access unemployment insurance at a time when more Georgians needed it than ever. And I'm really proud to say that our literature on unemployment benefits in Georgia was accessed by over 50,000 viewers in Georgia, and required GBPI to really play this role of intermediary to make sure that people who depended on policies understood how to access those benefits. And then GBPI had to pivot to doing something that we have often done, and that's fight against budget cuts. In the midst of a pandemic recession felt both within our state, within our country, and across the world, Georgia lawmakers were making decisions to cut budgets to critical services, including healthcare, unemployment benefits, safety net measures, K-12. We faced a budget cut of almost $1 billion to our K-12 schools at a time when students and teachers were being asked to do more than ever with less than ever. And the reason why this drumbeat has been so important to GBPI then and now is because Georgia is not in a position to have to make these budget cuts. We have rich and robust revenue reserves that have remained entirely untouched in the midst of a global pandemic. We've come now frequently to saying, we have a rainy day fund. Is it not raining? If this does not rain, what is rain, right? And I think the point that I want to underscore specifically here as a development professional and as a grantee of AWF is that we saw a full range of reactions to COVID from our funder community. We saw major commitments halved. We saw uncertainty of how project-based investments would or could work in a remote posture. And we saw foundations who, unasked, automatically reached out to help. And AWF was one of those, to give flexibility against project ideas that you had in 2019 that 2020 made an impossibility. And for organizations like ours, that flexibility meant everything. It meant that we were able to deliver on our mission in a unique way that we couldn't have anticipated before 2020, because our missions didn't become less important. They just became delivered through a different means. And beyond just the dollar and cents, I also really want to underscore that what GBPI took note of, and I think what most organizations took note of, is what funders, donors, and philanthropically attached people leaned into the conversations that 2020 demanded and which ones did not. And I'm really proud to be a grantee of AWF and say that they leaned into those conversations, and really proud of the work that our organizations are able to do because of philanthropic entities like that who are willing to have the risky and bold conversations with us.
Thank you, Lindsay. That's really helpful. And then Jamie, if you could help us understand again, to restate the question, just what you had to pivot, what innovation you tried, what success you had, and how AWF's partnership was integral for you.
I think it's interesting because as all the women and girls that we serve, we all had to adapt, right? And so the very things that every single woman and girl was forced to do during the pandemic, we as women-led organizations did the same. And we learned from each other in the process. And so, as I said before, we did have to accelerate our original plans and go from, we were in a city-owned and operated building. So City of Atlanta buildings shut down, boom. So it's been, and so we did have to take, and our healthcare is provided by paid staff, but also volunteers. We have around 21 volunteer healthcare professionals who do provide free primary care in the evenings. And so they had to kind of get caught up to speed and be willing to do telehealth, to learn a new electronic health record system. And so one of the learnings in that was that it actually made our clinicians safer. They were able to be safely from home, continue to provide care. It did increase access in many ways to women in terms of alleviating barriers to transportation and childcare and all other things that previously sometimes, could be a challenge in terms of completing appointments. So implementing telemedicine was one of the things that we did. We also work with around 700 moms, babies, and dads a year doing a maternal and infant health program called Healthy Start, where in the past, it's a very high touch program in which we have family support specialists who are out and doing home visits, and they are working with moms and making sure that they have access to prenatal care and a host of health and social services. So that had to then become virtual. And so any platform that worked for mom worked for us, whether it was FaceTime, Zoom, whatever. We wanted to do and accommodate moms because it was about them. And we were able to still have very meaningful connection and make sure that they were getting the infant supplies that they needed. We were dropping off items and continue to do so. But the other thing that's important, specifically around AWF, is that years ago, they were really the first funder, among the first funders to support mental health services at our center. And so that's important because we were not a current grantee for AWF, but because of the pandemic and the work that we were already doing because of the support of AWF, we were able to really increase and expand upon mental health services. So immediately we converted that to telehealth. And we have volunteer psychiatrists, but then we also work with partner agencies such as Odyssey. We've actually added another contractual therapist to do specific therapy with postpartum moms and pregnant women, just because their needs were greater. I mean, now, especially giving birth during a pandemic, women don't have that same support system. It's, now it's a matter of who can come with you when you deliver. So there are all other issues that are happening now with women who are delivering during a pandemic. And so we actually have provided more mental health services in this past year than we had before. So that was a big win for us. But then the other thing I would say with AWF is what I really appreciate is there was an opportunity to get PPE. They reached out to us because they had a partnership with a company that was delivering, and we received like 5,000 units of PPE, so which was tremendous. And so I say that to say that AWF, I agree with Lindsay and the others that they have truly been at the forefront because they've been so intentional about not only uplifting women and girls, but uplifting agencies that are, that are really solely about women and girls and women-led leaders like myself. So I appreciated that intentionality around making sure that not only were women and girls thriving, but that also nonprofits were thriving during these times.
Julie,
yes.
if I may chime in.
Yes.
I think, Lindsay, you pointed this issue out. Last year, we saw a major shift in terms of donors' giving strategies. We understand their priorities shifted immediately to COVID's immediate needs like food, shelter, housing, which are all very critical and important things. So as an organization where we support literacy, education, employment, economic development, the whole business model of workforce development, it became very difficult for us, and I'm sure for many of the nonprofit that is in the business of providing these services, to urge donors to continue to support them with education-related program because that was not the priority. So I do want to, appreciate Atlanta Women Foundation for giving us that support because their funding allowed us to keep up with the adult education and work readiness program that we offer. In addition to that, and again, I started with Literacy Action last year. So for me, innovation was important when we came in, but quickly innovation turned into sustainability. So the funds from Atlanta Women Foundation allowed us to sort of kind of transform as we were performing because we realized we were living in this world of where people needed food, shelter, housing, but to really have the impact on this economy to recover from COVID, where people have lost jobs and many were people that are underemployed. The challenge was, how do we retool them? How do we reskill them? Because many of those jobs were not going to come back. So one thing we introduced last year, and we're still trying to fine tune it, is the Women Want to Work To program, which means introducing women and girls to non-traditional occupational skills training in construction, in IT, in healthcare. The goal is we can help them get into or develop a career pathway for them that will lead to economic development. So I have to say, stakeholders like Atlanta Women Foundations, I appreciate you giving us that support, because it allowed us to provide, free and stigma-free classes, I should say, to our participants.
Thank you. Thank you for chiming in on that, Sandeep. And thank you all for helping us understand what the challenges were last year and how important and vital AWF's support has been. I'd like to turn the page now that we're sitting in 2021. We have a lot of people getting vaccinated. I think for a lot of people, we think sort of COVID is going to be something that we put behind us. And I know for those of you on the front lines know that we're still right in the middle of it. So I'd love to start to talk about now and going forward. And some people are talking about business as usual, that we're going back to business as usual. And I'd love to understand from the perspectives of each of your organizations, what does that look like? So meaning, what can we do to support you, and how can we understand what the future is going to look like for you? So what challenges do you anticipate as you start to resume business as normal? So Tiffany, maybe I'll have you jump in on this first.
As we look to creating a new norm, right? Because there is no going back to normal, right? And as we're working with our girls, again, we talk about this long hauler syndrome. So we're really focused on the social and emotional needs, looking at trauma-informed care for our girls, because they've been through a lot. And so trying to bring them into an environment, again, where they feel safe, a safe space for them. We know that right now we're going to move into the summer into a limited capacity summer camp. And so we want to re-engage our girls in a safe manner, still keeping up all of our COVID expectations in terms of wearing masks, but we want to get them back into a safe space. So we're going to be creative with them. But we also recognize, again, that academic loss is tremendous. And so we really have to step up our game in terms of supporting our girls and trying to head off some of that academic loss and helping them to regain those pieces of it, giving them a safe space where they can come in as girls, but come in with the academic support that they need in order to continue to thrive. What we found is that our girls are resilient, but they developed survivor skills, and we want to help them to develop thriving skills. We want them to know that, yes, this may take some time to move through, but we're here to support them. But we've got to support them when it comes to the social emotional pieces of what's going on, helping them talk through, work through, but also academically supporting them to move past the loss that they've learned, the loss that they've been going through when it comes to this academic piece. And it'll be hard for someone, because some of our girls have remained virtual all year long. So they have not been in a classroom for over a year. And so that may be a little bit difficult for them to move back into a classroom setting, still with everything going on. And so we want to just support them all around when it comes to their mental health, but especially when it comes to getting them re-engaged into academics. But we have to do that through more of a social emotional lens versus just throwing them back into the school classroom, but helping them to develop those soft skills and supporting in those soft skills that will help them be successful with their academic skills.
That's great. Thank you, Tiffany. Alnore, I want to ask you sort of a similar question. So as you look to sort of, and I almost hate to say post-pandemic life, but as you look to 2021, 2022, and you think about how your agency has had to respond, what steps do you think you guys will need to take in order to resume? And again, whether you want to call it business as usual or the new normal, what do you think that the next year holds for you guys?
So definitely it's going to be a new normal. We have seen an increase in the need for mental health services, especially within the immigrant community and the refugee community. However, that has been a challenge in the past, and it will continue to be more of a challenge now because of language access. So language access is definitely one of the bigger issues when it comes to accessing services. So it's hard for someone to access mental health services if the counselor or the therapist does not speak the language directly. Having a language line, there are nuances that are missed when it comes to communication. Also, Again, new policies and procedures have to be in place, especially for our shelter, just because of COVID. And I don't think that's going to leave anytime soon. And it's just also providing extra support for women and girls that need assistance with social services and legal advocacy. We see that those are increasing. As Tiffany mentioned, now that summer is approaching, summer camps are not going to be easily accessible. We have an after-school youth program, but that's going to be hard because it's not going to be in person. It's going to be limited in capacity. So for girls who are in the shelter, they won't have access to that. So everything is virtual. And so it just adds extra layers of challenges. And so we're trying to be creative. We're trying to implement new healing initiatives where we can address it culturally based on, what culture and language the clients speak and where they're from.
That's helpful, Alnori. And I thank you for the way that you guys are already starting to think about the summer and how you're going to meet the needs of the women and girls that you serve. Jamie, I'd love to take us a next step from that question. And as you think about this year and next year, what do you think the biggest challenge is going to be as you guys, again, have to start to deal with yet again a new normal and thinking about what your organizational challenges will be, but also in terms of delivery? What do you think some of the biggest challenges are going to be?
Yeah, well, I just, what Alnori said, it hit a nerve when you use the word healing. And so I want to, if I can just talk about that, because I think that, when I think about the new normal, number one is I hope as an organization that we all appreciate each other a lot more, in terms of the staff, and that we've learned a lot over the year, because we've had to be supportive of each other. We have had, we've been impacted by COVID. I think all of us I know have. So we've had staff who've lost family members, staff who've gotten COVID. And I think that we have to do the work within to make sure that we ourselves are healed, because as nonprofits, especially direct service nonprofits, there is a trauma that comes with just trying to respond to all of the hurt and the pain that's going on for the past year and continues to go on. So I just wanted to say that. And then as I think about what that looks like in terms of service delivery, it is really the continuation of that healing work that you talked about. The mental health services happening virtually. We've been adding on some things because not everyone's going to want individual therapy, but we've done a virtual yoga series, virtual art, using art as healing. I want to make sure that we stay community informed, that we're flexible, that we are continue to be adaptive. So for some, whatever it is, it's always going to be around how do we maintain connection, right? So some of these services are going to happen in person safely. Some of them will continue to be virtual because that meets the needs of women in the community. But I want to say this: when we did COVID relief work and we looked at social determinants of health and we asked women were completing the application, half of them said that they ate less because there was not enough money for food. So I just want to sit with that. I forgot to mention that earlier, but as I was looking at this information, 3/4 of them worried that they were going to be they had enough they would have stable housing within the next 2 months. So why am I saying this? 2/3 of them reported that electricity, gas, or oil or water was threatened to be shut off. So this is real stuff, right? And so how do you then, going back to what Tiffany said about this kind of survival, how do we all move out of the survival mode into thriving mode or as an organization, as the staff within the organization, and as the women and girls that we serve? So I think that to get to your question, Julie, I think that we're going to have to continue to be flexible and define, how we do this work. Certainly there are going to be challenges, but we're committed to addressing those challenges, and we're committed to working together with other agencies and AWF. And I think that we're just going to have to do the hard work and know that we need connection. And so the challenge is going to be, how do we can continue to make sure that women and girls are connected, whatever that looks like and in whatever capacity is necessary for them and works for them.
Thank you, Jamie. That's helpful. Lindsay, I want to ask you, I think you have a unique perspective here. What do you see as the top priorities as we think about bolstering services and infrastructure going forward? And as we've heard from all of the panelists, there's so many needs. So we think about childcare, mental health, education, workforce development. Can you help us start to think about it? It might be an impossible question, but how to prioritize those needs, and what do you see as the top priorities?
Absolutely. And I want to start off by saying, you know, from a policy perspective, from a systems change perspective at GBPI, there is no going back to the old normal. It's really about building this new normal that everybody's talking about. The good news, I would say, is that very, very little, if any, creativity is needed to help rebuild women after COVID-19. Our lawmakers, our state leaders, they have a slew of proven policy options that could lift women and girls and children out of poverty, improve their healthcare access and outcomes, and set Georgia women on a track to economic prosperity. Some of those that I'll highlight as, you know, kind of low-hanging options would be fully expanding Medicaid and enacting a state-level earned income tax credit. So full Medicaid expansion, which I will add is now cheaper and easier than ever for the state of Georgia, would extend healthcare to more than 500,000 Georgians who are currently uninsured in the midst of a pandemic, including mostly children and more than 137,000 women living in poverty. And an earned income tax credit, which is a tax benefit that rewards Georgians for working, has proven direct health benefits of an outsized impact for women associated with maternal health, prenatal care, infant health, and women's mental health. I will add that, you know, if lawmakers are feeling bold and are actually really committed to the effort of rebuilding women, there are plenty of other and bolder policy options that include increasing assistance levels for programs like TANF, Temporary Assistance for Needy Families, or SNAP, which is often referred to as food stamps. We can streamline access to safety net programs so that when women find themselves living through a global pandemic, being able to access benefits that they need isn't impossible. We can talk about paid family leave or increasing the minimum wage or banning pay history questions. You know, the list of policies that are available to lawmakers to help rebuild women is not a short list. And in Georgia, you know, the only place we can really go is up. So the options are out there. We don't need to be creative. We don't need to reinvent the wheel, but what we do need is common sense and compassion, and rebuilding women is really possible. The final point that I want to underscore from the perspective that GBPI takes, and something that I think is really, you know, a call to action of sorts, is recognizing that an equitable recovery will not happen on accident. It will not happen to us passively. As nonprofit leaders, as donors, as philanthropists, as individual constituents in the state of Georgia, an equitable recovery depends on our demanding it. And I really want to call everybody in and call everybody to the conversation that from GBPI's perspective as a state budget and tax think tank, the state budget is a moral document, but more specifically for all of the reasons that I just laid out, the state budget is a women's issue. And women need to be called to the table to really engage in this process. We work very hard to make that process less opaque, but it is opaque and is intentionally so. So I just hope that if we take anything away from this conversation today, from the perspective of the Georgia Budget and Policy Institute, it's that state budgeting and state policy is really an issue that has tremendous and outsized effects on women's and girls' lives, and engaging in that process could pay enormous dividends.
Great, thank you, Lindsay. Before we start to wrap up, I want to sort of flip and ask you one question about something positive. So as you think through the past 12 months, and then looking forward 18 months, and you think through the way you've had to pivot, we've talked a lot about innovation. Is there anything positive that you would say that your organization has experienced or will be doing differently because of COVID? And we're rounding near the end of the conversation. So I'm just going to ask a couple of you to chime in. So if anyone feels really strongly about something that you think has really been a positive takeaway because of this experience over the past 12 months, and as you think about the next 18 months, if you could let us know something positive to start to lift our spirits a little bit.
Julie, I'll be happy to, you know, sort of kind of start over here. I think not just for Literacy Action, but also for our region, our state, and even for the entire nation. far too long, I think we had all talked about our academia, our school system transitioning into distance learning, digital learning, and all of those. But none of those plans were in place. And the lawmakers, the policymakers at the local, state, and federal level had all talked about these things, but these were all long-term plans. So I think, and again, by no means I say that, how the world has transitioned in the light of COVID. There are some positives to it in terms of how we have all pivoted, how we have all transformed, how our policies have transformed, how our systems have transformed. If you look at the school system, who knew we will be able to do schooling from home for a whole year? And again, yes, in one breath, we can say that the students have missed the education component. There's certainly going to be that gap there. But at the same time, we didn't stop the train. Students are still getting educated. And I think at the same point, the challenge remains is there's not enough statistics out there to support, will there truly be an education deficit after we come out of COVID? Now, clearly, there's going to be deficit when you talk about access to resources for communities that don't have those resources. Clearly, there's a challenge there. But I think one positive that I think coming out of COVID is it forced all of us to shift and innovate in ways that we had never thought we will be able to do. We're providing services to our clients with women, girls, students, everybody in such a way, making sure that they have access to resources. Well, while their priorities have shifted, we know our women's, they are caregivers. We know women's are educators also. Now our roles have shifted, but at the same time, it has become very important for women and for, I think, clients all around and for organizations like us to understand where is the need for our people? What is the need for the communities that need these services? And how can we all collaborate at this time while we have all innovated our service platforms, while we have all innovated and shifted our business models, but we are in much better equipped position to see what's coming in 2021. We are better equipped to collaborate. And I can't say this enough, Julian, to everybody. Collaboration and coordination is the word for 2021. We all have such wonderful services. Many times we realize in our region, we're duplicating our efforts. But what we have to do as solid community-based organization is come together and tie each other and commit each other to build some kind of partnership that will provide holistic wraparound services to our women and girls. Because like we help with workforce development, clearly we need more partnership with organizations that can provide holistic wraparound service, whether it's food, whether it's shelter, whether it's childcare. Because one thing that is only going to keep our students in the program, especially women and girls, in terms of education and academia, is if they have these support systems around them. So I just feel that we're better equipped to innovate, collaborate, and coordinate in the year of 2021, and we can predict better.
Thank you, Sandeep. Tiffany.
You know, what I would tell you is that we have had so many wonderful conversations, very different conversations than what we were having before the pandemic with our partners. Our partners have really taken a deep dive with us, being willing to come in virtually and support our girls, becoming more interactive with our girls, right? Instead of just writing a check, right? They're saying, how can I help? And then saying, okay, my check, I want my check to go toward directly providing access so that a mother doesn't have to worry about paying for any type of programming, any type of service that you have, right? What does it take? How much is it? What do you need? And so we've had very different conversations. We've had more partners who we wanted a relationship with prior to the pandemic come seek us out and say, how can we help, right? And so that was a different lens to see they get it. They see the need, they see the importance of going beyond just writing a check, but how do you become long-term involved in the lives of our girls, right? How do you work with them to create and see the workforce that you want to see, 10 and 15 years from now? How do you do the hard work, right? And the hard work is harder than writing a check, right? But it really is getting involved and understanding what are the needs of our girls, but to the point of, the wraparound services, right? We work with girls, and I can work with girls all day long, but they go home to the same environment, right? If that environment at home doesn't change. And so for us, it was about how do we provide with partners wraparound services for our families so that we change the family environment, the family dynamic, right? And so with that, we recognize that it was just amazing to see, calls and emails. They're just like, oh, wow, I've been trying to get that call for 3 years now. And I'll take the call any way I can get the call, right? But it lets me know that the pandemic has opened eyes and allowed people to see a vision that we've been talking about for a while. But now people are really understanding and we're really choosing to invest. And that's what our partnerships are about right now. They're about investments into the futures of our girls. They go beyond the here and now, right? But they take that into consideration, but they're focused on the future and the future of our girls and the futures of our families and how do we impact the family dynamic.
That's great, Tiffany. Thank you. So we're going to wrap up in just a couple of minutes. Alnori, I'd love to have you jump in and help us understand. A lot of the people watching today want to know how they can help. So obviously, one way is to support AWF. We've heard today lots of great examples how working through an organization like AWF, which has a strategic platform, which helps to work across different types of initiatives, is super important. In addition to that, Alnori, is there anything else? If someone's listening and they say, in addition to writing a check to AWF, what else can I do? Do you have any suggestions?
Well, definitely other organizations are always looking for volunteers. As some of us have already mentioned that we get calls for volunteers. So volunteers are always welcomed. And I also want to put emphasis on even as neighbors or partners. So I know during this time, issues have been coming up. And so through the gender-based violence lens, safety is always an issue for women and girls. So I also want to say, don't turn a blind eye to issues that are in front of you, but also be aware that, there are appropriate ways to help. So if a woman is getting abused by her partner, will her safety be further compromised if the cops are called because she doesn't know how to communicate or because of her immigration status? So, just being able to also be a good bystander, I think, is one way that people can help. But I just wanted to put emphasis on that through domestic violence because it is happening. We see it. So that's one way to help. It's the simplest way to help, being able to advocate on other people's behalf. Being able to call a DV service provider to ask for help for your neighbor, for your friends, family. And then also definitely calling up other organizations in the area and asking for ways to volunteer, whether it be helping with food distribution, whether it be helping provide transportation, if you are comfortable with that, or just even accessing, like for us, for example, we have an Amazon wish list. So women and girls, when our funding can't support what they're asking for, we have a wish list of specific items that people can pay for, and it goes directly to the women and girls.
Great. Well, thank you. Thank you guys so much. We have hit the end of our time together. You guys have done such a beautiful job of helping us understand not only the plight of women and girls, but all of the hard work that you guys do. So I just applaud you and thank you for your efforts. I thank you for your time today, guys. I'm going to hand it back over to Kari, and thank you for taking the time to be with us.
Yes, Julie, thank you so much for guiding the conversation today. And again, to all of our panelists for the amazing and important work that you've been doing in the community. And again, helping to share the story that you all have been dealing with, what you've been dealing with over the last year. It's so important for the community to understand the needs and how best to help. So thank you all to everyone who joined us this morning. We appreciate your time and hope again that this was inspiring and motivating for you. Thank you. Take care, everyone. Be safe.
Thank you, everyone. Have a great day.
Thanks, everyone.
Thank you.